LDL cholesterol lowering therapies are available, that's true, yet levels remain high for millions of Americans. Up to 10 million people haven't achieved optimal cholesterol levels. But this is encouraging. The FDA has approved a new treatment for high cholesterol. Here to tell us about it, endocrinologist Dr. Harold Bays, and Peggy O'Connor is a patient. It's good to see you both, and thanks for joining us.
Thank you, Mary.
We'll get to the what's new here, doctor, but Peggy, I want to start with you. What kinds of challenges have you faced trying to manage your high LDL cholesterol?
Well, I was diagnosed with high LDL bad cholesterol a number of years ago and tried altering diet and exercise along with my doctor's recommendations. And in 2011, my doctor recommended that I start on the standard treatment with the statins, and I was still not able to achieve my goal. And in 2012, I suffered a heart attack where I was still not at my LDL goal. And in 2013, my doctor afforded me the opportunity to join the clinical trial for Praluent, this new medication. And I went through the 6-month trial, and for the last year and a half after that, I've been in the open label use of the Praluent, and since then, I have been either at or below my LDL bad cholesterol goals.
That changes things big time for you, Peggy, and I imagine a lot of other people who might have a similar history. Dr. Bays, would you tell us about this treatment and how it's different from what was already on the market?
Well, first of all, I want to echo what you said, Mary. I think it's exactly right. I think when people have a heart attack, or particularly if they know a family member that's had a heart attack, I mean, that can really change people's lives and bring them a different perspective. As a clinical researcher, I've been involved in helping develop cholesterol-lowering drugs for over 2 decades, and it's just very interesting that we now have this new class of agents, a brand new class of agents that we've not had before, and the very first one approved, FDA approved, is called Praluent, and it works different than that of the statins. But I think what's important is that if you have a patient, say for example, who has very, very high cholesterol due to a genetic abnormality, or a patient who's had a heart attack and yet still has cholesterol levels that are above their goal, yes, they need to be put on the statin, and that's true, the maximally tolerated dose of the statin. But in addition, if the patient's not at goal, then we got to do something else, and that something else in this case could be the addition of the Praluent, where in clinical trial support that you get a significant further reduction in that LDL cholesterol when you add that Praluent to the maximally tolerated statin dose.
While we have you here, I'm wondering if you would take us through some of the things that patients should discuss with their doctors, or that doctors should look out for if a particular type of patient comes through the door and needs the help.
That's a great point, Mary, is that again, if you have a patient who has a genetic abnormality, you know, we call it familial hypercholesterolemia, where their cholesterol levels are just very high based upon a genetic basis, or if they've had a heart attack and they're not at their cholesterol goal, then this would be the, you know, if that patient's on the maximally tolerated statin dose and they're still not at goal, that would be the indicated use for the Praluent. What I would also tell the patient, and certainly the clinicians, is that there's additional information that you can get on the website. They have a website. It's called www.praluent.com. That's Praluent.com. And at this website, it goes through things like a little bit about the drug, but also how to administer the drug.
Well, Peggy, I'm glad you were here to share your story, because I feel like a lot of people watching relate to it. They identify with what you were saying. And it's got to feel good to know you've got the help you needed all along, and the FDA has now approved it. Thank you, and Dr. Bays, we appreciate your time as well.
Thank you.
All right, thank you.
Thank you.
Thank you.